Wait, real quick, just before I forget, when do I need to start working on my taxes? Right now?
I mean, it's due April 15th.
I know, but Dad, I'm new to taxes. My first year having a job. Like, do you need 3 months to do it? Do you need 1 month? The reason I'm asking is because I haven't gotten anything from my employers. Like, shouldn't I have something that like summarizes what I did?
Yeah, actually the deadline is
The third.
tomorrow. Yeah.
Mm-hmm.
So they'll send you something. And then
Okay.
what you do is you send it to Brad.
Yeah, I already got
Uh
something from him that was like, so because I have to submit my loan. I have to submit. That might be it.
you're making it sound like it's this huge, you've
Is
got one item you've got to deal with.
Well, no, but I have one item, but I have three employers, so I have to send three separate things. A lot.
Goodness. Yeah. You push send 3 times.
Well, when they haven't
Done.
sent it to me, it's kind of a big deal.
All you have to do is take a picture of it and then send it to him
All
of
right.
the
I need them to send it to me.
W-2 or 1099, whatever you got.
Got it. I will do that. Okay, so I'm not behind. Um,
You're doing great.
Thank you so much. Oh, the other thing I did is so I tried to dye my eyebrows at home, which I've done
They
before.
look dark. Yeah, they look a little on the dark side.
Okay, well, you just told me I looked good, so let's
You
remember
do,
that.
but now that I'm centering in on it, I kind of see like the changes you went
Well,
through.
so I tried to do it at home to save money because that's what I like to do. And I turned them orange.
Was that what you were going for?
It was
So who got it? Who got it back to a naturally occurring human?
So I went during my lunch break the day it happened and really nipped that in the bud. I started to get feedback like, "Holy shit, this looks crazy." And I was like, "All right, I'm gonna go right now."
And this is from young Invisalign patients, like 10-year-old boys and
No,
girls
none
telling
of
you
the
this?
patients told me that. That would
Oh,
that I mean, then I would have left early. Like that would have been
uh-huh.
really demoralizing, but no.
It was Gabby who told you.
Everyone. Well, it was actually Sydney's doctor. She's a PA, and her doctor was like, she's got to get that fixed, like now. And he goes, and tell her I said that. So I was like, okay, I'm making an appointment. So yeah, it's not without effort.
Who are we talking to today?
Okay, so his name is Nick Mavrostomos. He is a general dentist, aesthetic dentist for APA Aesthetics. And APA is the like holy grail of aesthetic dentistry. He has a practice in I think Dubai, Manhattan, and I want to say LA and maybe Miami. I don't know, but he's a big fucking deal. So the fact that this guy's like my age and he works for him, like he is my colleague's dream position.
What is aesthetic dentistry?
It's
Like, what does
mostly
that
like
mean?
veneers. So it's like people who like have I mean you have veneers, but veneers are very hot right now. Like people who don't really need them are getting them to be honest. But
Is
it
it
looks
still like the way it used to be, where they glue a veneer onto each tooth, after they take a model of your mouth and everything? It's like, so it's a
yes.
major thing. Right?
Nope. And then there's all over social media, people are like, now my teeth are totally shaved down like shark teeth, but now they're having to prep less with different technologies. It's very technical. And so the fact that he's at like the top of the top, I mean, the company APA Aesthetics, which is now the senior doctor, he has courses where he's teaching people like everyone if will take a photo with him, like he's kind of famous. So today we're sitting down with Dr. Nick Mavrostomos, an aesthetic dentist at APA Aesthetic. If you aren't familiar with Dr. Appa, just look them up. You'll definitely recognize his work or people walking through their doors, frankly. So, Nick arguably has one of the dream jobs in this industry, but it wasn't by luck that he got there. He had a really specific vision for his career and did whatever it took to make it happen. Dr. Nick has also created his own brand and following through his wildly natural before and afters of his veneer work. And these shock people. I've gotten messages from friends being like, you need to talk to this guy, and they were not wrong. So, in this episode, we go over his background and the exact steps he took to get to the top. This conversation is obviously great for general dentists looking to do aesthetics, but it's also really for anyone in a non need based medical business that wants to be in the top of their field. So, I really think people will enjoy it. He's impressive, I
For
would say.
sure, for sure. Because I know a bunch of your dental school friends are general dentists who are sort of looking to kind of get out of the more mundane stuff and get into aesthetics and all. I think a really good piece of advice that he offered was if you're in a general dentist practice and this is something you want to get into, go use your patient population and say to them, I think you're a really good candidate for veneer, assuming that you do believe that,
Right,
obviously.
right.
I think you're a good candidate. And it's something that I'm beginning to focus on, and I'll do it for $7,500, $5,000. It sounds like his charges are more like
Yeah,
high
yeah.
30s, low 40s kind of thing. But find somebody who's young, who's got generally a good mouth, so it's not one of the really challenging cases out of the gate. But also use that as an opportunity, kind of as a loss leader almost, and just get some under your belt. That sounds like a good approach to me, especially
Totally.
given it sounds like among people your age that there's a lot of demand for this, which I don't
I think
really
with social
have a
media,
feel for.
people are so aware of everything with their face and how they look all the time. And then they see their favorite influencer has these perfect white, pearly teeth. And then they see that they went to this person. And so I think he's right that it's a lot of word of mouth. And I was like, that's super smart how he did that. And I get this because I feel this way too. A lot of us are ready to make some money. It's like we have loans, haven't made money for years, and you want to get a big cash out from a nice aesthetic case. And to his point, it's for the long game. And if you net zero on your first couple of cases, who cares? You're totally like just fresh warming up. And by the way, you shouldn't really be making bank on your first couple of cases if you're like that fresh. So I think just his attitude was exactly right and extremely goal oriented. And he knew exactly what he wanted to get where he is. So very inspiring, very, very cool story. I need to look. He's definitely done some celebs. I didn't ask because I felt like, I don't know if he would have shared that with us, understandably, but he's definitely been with some cool people. So people should check that out. Let's welcome Dr. Nick Mavrostomos to Medical Morons. Well, you're so young and you've gotten into this great position that most of my friends would die to be at APA Aesthetics as a general dentist doing cosmetic work. So tell us a little bit about your background and how you got there. Like getting jobs in dentistry and any type of specialty in Manhattan is very hard, and I'd say you have one of the best ones. So how can people emulate that?
Yeah, I mean, it wasn't by accident or chance. I had this kind of as my goal, and specifically as my goal since I was a sophomore in undergraduate college, right? So my dad was a dentist, a general dentist as well. So I watched him doing a lot of general, some cosmetic. And from a pretty young age, there were elements of what he did that I thought I really liked. And it was really mostly the cosmetic stuff he was doing. So I was pretty turned on to aesthetic dentistry, and kind of going through high school and then starting college. I wasn't really sure exactly what I wanted to do, but I knew I wanted to do cosmetic dentistry, and I knew I wanted to be in New York. I grew up in New Jersey. So the city was familiar to me. And then I actually, by chance, happened to meet Dr. Appa when I was a sophomore in college at BU. And my dad was at Tufts Dental School. He was going there for a lecture, and Dr. Appa was one of the speakers. He said to me, he's like, hey, maybe you should come by and check this guy out. Like, I know you're really into the aesthetic stuff, and he's, really big in cosmetic dentistry. I think you'd enjoy it. And I just kind of went and I watched him speak for a few hours. And that was kind of my moment where I was like, this is who I want to work with. And, just was really inspired by it. So kind of from there forwards, I had a really specific goal, which was like, I wanted to go to NYU Dental School because I knew that they had a really strong aesthetics program. I knew it was in New York, obviously, and I knew that was near Dr. Appa's office. And I knew that I was trying to position myself to graduate, go to residency, and end up working at this office. So, pretty much everything I did through those years was with wanting to prepare myself to be, a good candidate for him to hire. So I started doing wax ups my first year of dental school in like my apartment. Like I was waxing stuff up all the time. And I did that all 4 years of dental school. I must have done 500 wax ups. I used to just pour out models or steal stone models from the lab or just take impressions on people, photograph them, trying to treatment plan in my own head. Other things I was doing was teaching myself how to do good photography, long before I was even treating patients in dental school, because I knew that that was going to be a critical part of doing good cosmetic work, being able to portfolio and showcase what you can do. And then going through dental school, I got into the honors aesthetics program at NYU, which is a really unique program where in your fourth year of dental school, you get to actually do cosmetic dental cases with the faculty. I knew that I was going to need a certain GPA requirement to get into that program. So, my first 3 years, I was really trying to keep high grades, high scores to get into that program. And then I did. And then I did a lot of cases during that program and so on and so forth. So, it was about, I think, knowing what my goal was and doing things along the way to try and prepare myself to not wait for the opportunity to come to then try and figure these things out and then try and prepare myself. I was preparing myself for, if I meet this guy tomorrow and he says, why should I hire you? I have reasons and things to show. I got into a great residency program, which again, I chose because I knew that this program allowed me to do a lot of restorative and cosmetic work, which is the VA program in Brooklyn. So everything I was doing for many years was geared towards and aimed at wanting to be a good candidate to, attract him to want to hire me. And that's what happened. Actually, one other thing that I did was, at this point, he had kind of heard about me through NYU and we'd met a few times and spoken a few times. I'd gone and shadowed him a few times. He'd kind of seen these things that I was doing and knew that I was doing well in the honors programs and such and such. I actually registered for a continuing education hands-on veneer course that he taught. And my whole purpose of doing that was I wanted to actually do a case in front of him and to literally say like, hey, this is what I've learned so far. Look, I can do this. And I asked him to mentor me on the case as a chance to showcase what I can do and how my hands work and just my feel for these kinds of things. And that was actually when he ended up offering me a job. He's like, I'm impressed with what you're doing. I'm in for an interview. And from there on, that was it. So people ask me that. I know it's a very long answer because there's just more than just a simple answer to it. But it was about just kind of realizing my goal early, which not everyone can necessarily do and know exactly what they want to do. But I think the sooner you know what you want, the sooner you can start preparing for whatever it is and then do things to really position yourself and stand out. So that's kind of my background of how I ended up here.
Yeah, I mean, that's awesome. And it sounds like you had a goal and then you did everything you could to work towards that specific goal, which is not typical for the beginning of dental school. I definitely was not doing extra wax ups, and that might be why I like ortho. Dad, when we do wax ups, it's like you have to physically shape a tooth out of candle wax basically, and it's very technical and they typically look like potatoes in the beginning of dental schools.
Can you just maybe for those who aren't as aware, describe a little bit about that practice and what about it made you want to tailor your entire career planning and path to get into it?
I think what, Apple Aesthetic is a cosmetic dental office. Our main kind of flagship office is here in Manhattan, but it's expanded. So we have an office in Los Angeles and in Miami and another one in Dubai. The reason why that day seeing him lecture and wanting to really be a part of it from such an early age was because, especially at that time, that was probably in 2014 or 15 or something like that when I saw him lecture. It stood out to me because it was one of the only offices that was really built on this one procedure. Because, aesthetic dentistry is not a specialty, right? You get a general dentistry degree, and you can be doing root canals, you can do extractions, and do aesthetic dentistry as well. Anyone can do aesthetic dentistry. And that was kind of how my dad practiced, which was there was a general dentistry office, needed some cosmetic work. And I just remember feeling to myself, I just really want to specialize in this. I just want to do cosmetic dentistry. I just want to do smile makeovers, full mouth rehab. And I didn't really know if it existed. Kind of everything I had been taught and told coming up was you can't just focus on this. You'll never survive just doing this. You need to diversify and you need to be able to do this, this, and that as well, and so on and so forth. So hearing him speak about the practice he was building and what he was trying to build in dentistry excited me because it felt to me like the first time I had connected with someone with the same kind of vision of how they wanted to work, which was essentially to specialize on this procedure. So that was one major draw for me. And the other major draw was that they're very good. It's a really good practice. We have in-house labs with excellent ceramists. And I knew that I could learn a tremendous amount working with Dr. Appa because he's done so much of this work over so many years. So in part for me, I saw it as a really amazing opportunity because I felt like I had the skills, the raw skills at that time. Obviously, not coming out of residency fully ready to go, but I felt like confident in my skills and where I could go in this field. And I knew that if I could team up with him, I could learn so much, and that it would give me an amazing environment to grow in, because I'd be accepted for what I was passionate about, as opposed to being pushed back on to do all these other things that I knew I wasn't passionate about doing.
So that was your first job right out of residency?
Yeah. So I was about halfway through my residency program when Dr. Appa offered me a job.
Nice. So, okay, now you kind of got the dream. Now you actually have to do the APA way. Was it a rigorous training program? Were you expected to kind of do your own thing? I mean, something that would give me, I mean, it's good anxiety, but would make me a little nervous working for someone like APA is you're working for his brand. So if you don't do things to his liking, it reflects on him. And then he's going to be like, why'd you do that shade or things like that? So was it kind of like a blueprint?
No, so this kind of goes back to what I was saying about, I came in really ready for this because I knew what I was hoping for, right? So one of the things I didn't mention was I used to moonlight at my dad's office as well. But one of the things that I did was I learned and figured out what their protocols and systems were, in terms of what materials are they using, what are their steps in terms of appointments, like how are they prepping and temping and bringing patients back? What is their protocol to insert? What is their protocol to prep? What is their protocol for making, all the things, right? And I essentially, like when I was doing cases in my honors aesthetics program in dental school, when I was doing cases in residency, when I was doing cases at my dad's office on weekends, I would practice all their protocols. Like I would do everything the same way that I knew eventually if I was going to work here is exactly how I'd be expected to work, how I'd be trained to work. So I came in with already the training because I had really surrounded myself and immersed myself in everything that eventually I'd have to learn if I was going to work here. So it's not to say that I haven't continued learning or continued growing and continued being mentored. Of course I have. But I didn't come in blind and oblivious to how things worked and what the standards were and how we work, right? Because 100 people can do the same procedure totally differently, and that's not right or wrong. It's just preference and reasons behind doing things a certain way. But I kind of trained myself from my beginning years of ever doing this procedure the way I wanted to work if I was going to work here. So and I came in with a lot of confidence, and I think you have to have confidence to step into an office like this, especially being young. And it's not arrogance or obliviousness to like I still have a lot to learn, but I didn't doubt myself. I wasn't scared. I knew that I was capable of doing this procedure and that I still had plenty to learn when I first started, and I still am learning and I'll forever be learning. But I also at my core had a lot of confidence. So I think that helped me a lot.
When you first started out, did he oversee your work? And at what point did he start letting you fly solo?
Right away.
Okay. And so what was, what gave him confidence to entrust his patients with you? And were there any sort of things that happened in the beginning or along the way that were notable?
And just piggybacking off that, were there any patients who were like, wait, I came to see Dr. Appa and now, you know what I mean?
Good question. And the answer to that is I don't see his patients, and I didn't come here and I didn't get hired here to treat his patients, right? So whenever we hire an associate, it's on you to get your own patients. And so I started here with 0 patients.
So did you get a daily rate still or no?
Yeah. So I had a starting salary, obviously. But no, you're not hired here to treat the patients of the practice. You're hired here with the belief that you can get busy and add value to the practice, right? So I started having to find my own patients and own cases. So I started from 0, from scratch. And as far as like, was he overseeing my cases? No. I mean, of course, we would discuss cases at times, or I would ask him questions, or I'd, go over things with him. But he's hiring you to come in and build your own name and business within the branch of this company. And he's not going to hire you if you need your hand held to do this procedure to start. So that's kind of how I started. I started with nothing, and I started to build my own, patient pool, and slowly but surely build myself up. Yeah, I wasn't like walking into a room with a patient ready for me to see and a case to treat. What's the point of hiring me then?
So what was the ramp up for you like? And, following on to that, how do you brand? How do you market? What's your strategy or approaches for patient acquisition?
My strategy has always been the same, and it's I want to do really nice work, and I want to show this really nice work, and I want people to talk about it, and I want to grow my name through my work. So obviously, social media has been a big part of that. Just in terms of like displaying the work, word of mouth will always be king. No matter how much marketing you do, if you treat people well and they're happy with you as a provider and the work you've done for them, they're going to talk to their circles. And for me in the beginning, it was really about immersing myself in the communities of people that I knew. So again, all this goes back to like the preparation that I did when I was coming up through dental school and going through residency. Anytime somebody would ever talk about, oh, Nick, I know you want to be a cosmetic dentist. I want to do my veneers someday. Or, someone talking about wanting to fix their smile around me. I used to keep a list, and I actually still use this list to this day, where I would just jot that person's name down for future reference of like, hey, at some point I'm going to be doing this procedure. I'm going to need patients when I first start with nothing. I want a Rolodex of people I can call when I first start, wherever that's going to be. Hopefully it's at Aesthetic, that I can tap into this Rolodex. So that's actually what I did. And the first case I ever did at this office was somebody off that list. So I remember my very first day working here being like, all right, well, I've got to get busy. So what am I going to do to start? Let me call these people. And I probably called 25 people, and 22 of them were like not interested, and 3 were. One of them prepped the next week. So there's my first case. So I just think that I've just been very opportunistic, and I'm always thinking about these things. And I think it's like I read something recently and it really struck a chord with me, where it's like, what is it they call the red car theory, where, if you ask somebody how many red cars did you see today, and they'd say, probably none. And then the next day, because now they're thinking about it and they're noticing it, they probably saw 25 red cars. So that's kind of how I've operated. I'm always thinking about getting new patients, new clients, whether it's in a social setting, whether it's in a work setting, whether it's out and about in life. You know what I mean? Everyone's a candidate to be your patient.
In the beginning, did you do anything like offer discounts to people, to sort of build up volume, or were there any other kind of strategies that you used?
Instances where, if a treatment plan was 45 grand and the patient was like, my budget's, 37 grand. I'm like, all right, let's just do it. So yeah, you bend a little bit in the beginning, and your goal is just to get patients in your chair, like whatever it takes, whoever it is. If there's red flags all over the place about this person, who cares? My first year doing this, I would have said yes to anybody.
Yeah. I mean, that's what you got to do. So I kind of want to shift to your social media presence. Just from following you, I know you do a lot of befores and afters, but so do a lot of aesthetic dentists. I'm curious what kind of, I don't know if it's a tactic, but what kind of other creative things did you try to grow your social media presence to where it is?
I think part of it has to be like what makes you unique. So I like to make videos of just talking about various topics. The purpose of that is to educate, but also for a patient or a prospective patient to have a glimpse at how you think, how you project, and how you speak about what you do. And I think that's just as important as just seeing a before and after photo. Because the truth is, there's so much more that goes into the cases than just the before and after photo. Unfortunately, that's all we have to show. But things like patient testimonial videos are always interesting, where there's a story attached to this case. One of the marketing strategies that I've used is doing influencers' teeth and offering a discount for them to document their experience and their process, so that people have an insight of how this all works.
And will you just cold DM them, or?
No, they usually reach out to me, and I'm not doing that all the time, of course, but if I think somebody's worth it, I'll offer them a break if they're willing to document the case. That's a very powerful and quick way to grow your name. Now, it has to be a good audience. I've done things like that with people who you would think would generate tons and tons of business because they're a big name in X, Y, or Z, and I've gotten nothing from it. And I've done things with people who I thought was maybe a waste of time or wouldn't pan out to be anything, and ended up filling my schedule for 2-3 months. So you never really know, but that is another effective strategy that we've all employed here.
Is there a market niche that is kind of your bread and butter, a certain profile of a patient that
Yeah.
seems to be kind of where you play most?
I would, and that's something that takes time to even be able to answer, right? In the beginning, I would have said anybody willing to.
People with teeth, right?
For the last 4 or 5 years, and this is a average, but I would say a majority of my patients are probably somewhere between the age of late 20s to late 30s, 75% female with a mouth that's relatively in decent shape, but really focused on wanting to improve their smile. I would say that's a 60% of my patient clientele. Where most cases I do, I think the other thing that has become a common patient pool of mine are conservative cases. So that's something I've marketed a lot and done a lot of, probably because I started working here very young. I was attracting younger patients, and generally speaking, younger patients have healthier teeth. And if their teeth are pretty healthy, then that usually lends to being a pretty conservative preparation type case. Now, it doesn't mean that's all I do. I do plenty of cases on 55-year-olds, 60-year-olds, 7-year-olds with crown, bridge, more heavy duty stuff. But I definitely do see a lot of those types of cases.
So I have a couple of friends who asked me before this that are interested in veneers. The one I'm thinking about has beautiful teeth, but she's, everyone wants better. Everyone wants a better smile. Can you go through the process of who's a candidate for a prepless veneer? And Dad, what this means is, so my dad has veneers and, Dr. Nick has to shave down the teeth and then he puts the veneer on top of it. But now there's a concept that's these conservative cases that he's talking about where you don't need to prep the tooth and you could just put the veneer on top of it.
So not everyone is a candidate for prepless or minimal prep, right? And it really comes down to a couple factors. People who are prepless candidates are people whose teeth, number one, off the bat, have to be totally healthy, right? So there's no dentistry on these teeth and there's no cavities or infection. So the minute any of that is off, or there's old restorations in that smile frame that you're restoring, or there's decay, or there's other issues, it's immediately not a prepless case. So that's requirement number one. Requirement number two is that the entire case is going to be additive. So part of it is what are the goals of this person? And by additive, I mean, it's generally people who need longer and more voluminous smiles, right? So everything is additive, meaning the veneer itself is going on top of their teeth untouched. So that means that the end position of what we're going for is bigger than where their teeth are now. If their teeth are already the proper length, then I can't preplessly make their teeth because they'll be too long. Or if the width of their smile is already pretty ideal, I can't do a prepless case on them because then their smile will be too wide. So it's generally people with really healthy teeth who have really small teeth and they need length, they need volume. Everything that we're trying to accomplish is adding to their teeth. And that final position that we're desiring is allowing me to be able to do it without having to shorten anything or reduce anything. So that's why the percentage of people that fit into that category is not super high, because it has to, aesthetically, they need to have a certain type of teeth, and from just a health perspective, they have to have virgin teeth, untouched teeth. So those are candidates for no prep, meaning zero prep at all. But there's a much larger percentage of people who are candidates for minimal prep, meaning I am prepping their teeth, but it's very little. Again, those people tend to have healthy teeth. The difference being between the no prep and the minimal prep would be that not everything maybe in that case is additive. There may be some teeth that are in pretty good position that we're trying to maintain. So I'm going to prep very little in order to be able to restore them back into that same position. So I would say, 50% of my patients are minimal prep cases. I'd say 10% are probably zero prep.
How long does it last? What's the shelf life of a veneer case these days?
In good health, meaning, a patient that's taking good care of them, coming in for cleanings, they're not disappearing after this procedure, 15 to 20 years. At some point, all dentistry needs to be redone. Nothing, whether it's filling a crown, an inlay, veneer, nothing's done with the intention of that staying there forever. Granted, different materials have longer shelf lives, right? So porcelain inlays, porcelain veneers, those have a longer shelf life than composites, fillings, or composite bonding, things like that. Now, that range of 15 to 20 years can be shorter if the patient's a super heavy grinder or whose hygiene at home sucks and they've gotten a cleaning once every 2 years and they don't wear a night guard, and that might look like 12 years. for them.
You know, I have a lot of friends who I think feel stuck in their career, especially, unfortunately, in general dentistry. Everyone would love to do aesthetics. Unfortunately, they didn't have the same foresight that you did, you know, so they can't totally kind of imitate or mimic what you did to get where you did. But what would you say to someone coming to you who's like, I don't really love dentistry. I'd love to do more aesthetics, but it's hard to find a job out there, and all these courses are 20K, and you know, they feel stuck. What would you recommend?
I would urge them to start taking on these types of cases, to start getting their hands dirty with it, right? And people ask me these questions all the time. Like, I get messages every single day from generally younger students being like, what do I do to get to where you got? It's not one thing. It's not one course. It's not one weekend seminar. You have to really embrace yourself in this field to learn, to have mentors, to watch people do this, to read about people doing this, to see cases, and to practice it. Like, at the end of the day, you're never going to feel confident to do this unless you're doing it. Like, you have to just go through trials and errors and actually do this procedure. So my advice would be to find, number one, find mentors, right? I had so many mentors through dental school and through residency of people doing cosmetic dentistry, of people whose brains I could pick, who I could call and show them what I was working on, what their thoughts were, feedback, and then just start doing it. You know, you don't have to be at this office that I'm at to do a lot of cosmetic dentistry. You could be in a small suburban town in a family practice and do a lot of cosmetic dentistry if you can find the patients. So that's really what it all comes down to, is like, can you get a patient in your chair? Because at the end of the day, this procedure is not incredibly difficult to do. It is incredibly difficult to be busy doing it. And you can't get good at it unless you're doing a lot of it. I think the common mistake I see people do is like, they're waiting for all the stars to align perfectly to start this new chapter. And I'm like, it's never going to work that way. You just have to start somewhere. Start with the photography. Like, just start learning how to take photos. Start with, you know, simple cases on patients of yours for a discount just to get them to do it. Like, just start doing it, and then you'll start picking up momentum.
Yeah, I love that. Very good, like tangible advice that people can go out and practice. Dad, any kind of burning questions?
Yeah, just what these days I'm particularly focused on AI and interested how people are either using it. Is it becoming a substitute for some aspects of what you do in terms of the human element? Like, what is it? Is it part of your practice at this point? If so, how?
It's a great question. At the current moment, it's not, but it is certainly something that we're working towards integrating. Not in terms of anything with, you know, the clinical work, but in terms of things like, you know, monitoring phone calls or filtering through new patient forums and stuff like that. We're still working out how exactly we want to integrate it, but I'd be shocked if, you know, 12 months from now, there wasn't some form of AI integration.
Are there any tools in particular that you're evaluating that are out in the marketplace these days?
Specifically, I don't know. We've just kind of started these discussions. Where I think it could be the most useful is really with, you know, we get tons of phone calls. And, you know, as many hands as we have taking these calls, it's things just slip, you know, through cracks. Like, not every call gets answered. Not every call, you know, phone call gets returned. Not every new patient inquiry gets handled immediately. So I think, you know, some form of a program that could consolidate in a really precise way these incoming calls, these incoming requests for appointments, I could see that being super helpful. And maybe things like scheduling, you know, but you kind of lose the human element with that. And I think that's kind of the what's worth it, what's not, like AI. I think when it first became popular, I was a little hesitant. Just in my own life using it now, I think it's great. So I can certainly see that being a part of our practice very soon.
Okay, so I have one more question that I forgot
Yeah.
to ask. Do you have any plans on going out on your own and doing your own private practice? Is that something you see for yourself, or like you kind of hit the jackpot and you're gonna stay and just kind of grow your own practice? What are you thinking?
Everyone asks me that question. That's not my goal. My goal is to really grow my own name and value through this practice and to end up with partnership. That is my ultimate goal. So that's kind of where my mind's at. My goal is never to come here, learn, grow my name, and leave. I view myself as a really valuable part of this company, and for it to grow, I know it needs more players than just one guy. This can't grow past a certain point with just one person forever. And I've kind of known that. And that's kind of always been my goal, is to position myself to be, that next guy. Like, this practice had a turnover of people prior to Michael Appa. There was Larry Rosenthal, who really started this practice before him. Opening my own practice is not my goal. And if that did happen at some point in the future, something went terribly wrong.
Good to know. Good to know. I mean, given your track record, I see that for you. Last thing, any funny stories that have happened in residency, in your career, that like are just relatable for other clinicians, dentists, doctors?
Yes. I think my funniest story that comes to mind is in residency. We did a phlebotomy rotation, like taking blood from patients. And it was always right before, it was like the 30 minutes before going back upstairs to start seeing patients in the clinic. First day, minimal training, no idea what I'm doing. They showed me how to do the whole thing. First patient comes in, didn't realize how short that cord was, and, kind of pulled away, and it came out of his arm. He had the tourniquet on, and the blood was just spewing everywhere, all over the place. I'm apologizing over and over and over again. I'm so embarrassed. I'm mortified. And he's like, don't worry about it. Like, he's pissed, as I would be too. He's a veteran, it's the VA, he's pissed. He's like, just, stop saying sorry. I got to go. I have another appointment. I was like, I got to go back to my clinic anyways. I went upstairs. I'm telling the story to everyone that can listen to it. I'm mortified. I turn the corner in my dental clinic now to go call in my first patient. And who do I see? I see this guy holding a Band-Aid over his arm.
No.
And he was my first dental patient of the day. Because at that time in residency, your patients were given to you. Right?
Yeah.
So he was my first patient. You're my dentist? And I was like, yeah, I am. And he's like, are you better at dentistry than taking blood? I was like, absolutely.
Yes, right. This I got you in. That's hysterical.
That's the story I love telling.
Yeah, that's so good. Where can people find you, follow you, and get the APA experience with Dr. Nick?
So my Instagram's Dr. Mavro. That's where, I showcase most of my work and things going on. And I actually have a link on that for, prospective patients who want to schedule consultations. They can click into that and request a consult. Yeah.
Great. Well, thank you so much. It was so nice to meet you.
Yeah, thank you. Good guest. Yeah, really appreciate it. Thank you.
Of course, my pleasure. Have a good weekend.
Yeah, bye.
Take care.
Take care.
Thanks for listening to Medical Morons. Don't forget to subscribe, rate, and review.